Hello, good evening. Can everyone hear me? So my name is Siddharth Tambar, and I am the physician at Chicago Arthritis. And today I am talking about the Regenexx stem cell and platelet treatments for shoulder and elbow conditions. As we go along, please, you can type in your questions as they come up, and I will try to address them probably toward the end. If you have any difficulty hearing me, or if there's anything that doesn't look clear on the screen, please just type in the question or chat section so I can know immediately. Okay, so there are a number of goals for today's webinar. I want to at least give some general sense of comparing traditional care to a more modern regenerative approach to treating orthopedic injuries. I'd like you guys to have an understanding of the Regenexx difference in these treatments. I definitely want you to have a better understanding of what stem cells and platelet-rich plasma are able to do for some of these conditions. The benefit of PRP and stem cell treatments in particular for shoulder and elbow conditions are what you should come away from this. And as we're going along, if you want to cheat ahead and look at what some of the results are for some of the treatments that we're giving, you can go to my website at chicagoarthritis.com. If you go to, if you type in /results, you'll actually see some of the most updated results we have from within the Regenexx network about treatments that are working. Okay, so I'm going to start off by describing two different cases and try to discuss a little bit in terms of not only the clinical details of each case, but also discuss about PRP as well as stem cells based on these cases. So the first case is of a 40-year-old man who has left elbow pain. He's a lawyer, weightlifter, and also has been an amateur boxer in his lifetime. On his physical exam and ultrasound, he has lateral epicondylitis, also known as tennis elbow. The traditional care for someone who comes in with this sort of tendinitis is rest, anti-inflammatory drugs, physical therapy, steroid injections, and then eventually, as things get worse, even surgery. There are a lot of problems with traditional care. For example, anti-inflammatory drugs. We've started to realize that not only do they not treat the underlying problem, they actually have long-term problems with heart, stomach, liver, and kidney issues. In addition, steroid injections, which can give temporary pain relief, unfortunately also have the potential to weaken cartilage and tendon tissue. And if you get too many of these, they do have long-term systemic side effects as well, in terms of diabetes, blood pressure, osteoporosis, just a lot of bad things. And quite frankly, we can do better than that now. Traditional care, the problems are it doesn't actually fix your problem, does not modify the disease process long-term, and these are really only meant to be short-term treatments. They're not thinking about the long-term. Surgery, there are mixed results. While it may be appropriate in some cases, they don't work for everything. They can lead to persistent pain. For some soft tissue injuries, surgery to cut out soft tissue can actually accelerate the arthritic process. Surgical revision surgery is not a small thing at all and very hard. And these are really permanent surgeries, meaning if they work, that's great, but if they don't, you really can't turn back the clock once you cut out tissue. A newer paradigm is to correct biomechanics and to use autologous biologic treatments, such as platelet-rich plasma or stem cells, to actually either fix an injury or to at least treat pain if your injury is advanced. The advantages of these sorts of treatments are, number one, they're autologous, meaning they come from you. The benefit of that is that they're not synthetic, they do not have allergic reaction risk. They are generally limited risk, as they are injectable treatments. In some conditions, they have the potential to repair damage. They may have the potential to actually prevent damage from getting worse, in other words, be disease modifying. and they're generally healthy for your joints and tendons long term, which is not the case with medications and a lot of synthetic products that are injected. Because of that, there's not really a limit to the number of treatments that you get. They do take longer to work as opposed to, let's say, a steroid injection that kicks in immediately, but these tend to last longer than really all the other sort of non-surgical options that are available. Other conservative non-surgical treatments such as physical therapy, chiropractic, acupuncture, they can help a lot of people. They don't necessarily work for all musculoskeletal problems. They can certainly complement some of the Regenexx treatments, but generally they're not sufficient alone. So back to that first case of the 48-year-old man with elbow pain with a tennis elbow. He tried physical therapy for 2 months, still had persistent restricted activity, and that's when he presented to me. The picture you see on the bottom is an ultrasound of his elbow. And what you can see is the following. This bright white line is the elbow joint. This tissue where my arrow is running over right now is a tendon, the common extensor tendon that is typically injured in the setting of tennis elbow. And this area right here, this is the area where you have this black area. This is exactly where the tendon has been injured and it's pulled off from the bone. That is exactly what tennis elbow is. And you can imagine by injecting steroid into this kind of tissue that's already weakened, how bad that can be for the tissue. And by treating this in a more holistic and biologic way, you can actually help to repair this. So in this case, this gentleman received 2 PRP treatments over a 4-month period, and he was able to return to his full activity at full capacity, which is really a great result. So this is that same elbow, and this is a needle, this is a tendon, and basically under very precise imaging guidance, injecting his own very high concentration of platelets into where he has his injury to help repair that. So there are a number of key points from this. Number one, tendon injuries treated with regenerative approach is really, I think, the standard of care at this point, and certainly better than other non-surgical options. It's an individual that got a couple treatments, and there's safety in repeat treatments. And of course, all of these treatments are being done with very targeted, advanced imaging guidance to make sure that we're doing everything in a safe and very specific manner, which is really required for these kind of treatments. So, I've mentioned the Regenexx procedures. The Regenexx procedures, just a little bit about what are these kind of procedures. They are a family of non-surgical stem cell and platelet treatments for common orthopedic and musculoskeletal injuries. They utilize a person's own stem cells or platelets to help heal damaged tissue, tendons, ligaments, and cartilage or bone. The treatments that are involved with the Regenexx treatments are one or two, either the Regenexx same-day stem cell treatment protocol, which I'll talk about a little bit later, or 2 different platelet procedures. There's 2 different types of platelet preps that we use that comprise platelet-rich plasma. One is just a very high concentration of platelets called SCP, or super concentrated platelets, and the other is called platelet lysate, and I'll describe both of those in a moment. So what makes these Regenexx treatments different? Number one, the Regenexx network is a collection of physicians that I'm a part of across the country where we're offering similar treatments with set protocols, tracking results, and really trying to learn from each other in a very organized manner. The strengths of this network are that we're using consistent protocols, results are being published, and we're trying to track efficacy as well as safety measures. And quite frankly, we're constantly improving the treatments that are being offered. What we're offering today is better than what we were offering even 6 months ago. And what we'll be offering in a year, 5 years will be dramatically better. There's a focus on quality and safety and treatments within the network. We have a very specific focus just on orthopedic conditions. We're not treating anything else, neurologic issues, cardiac issues, lung issues. We're really only focused on these sorts of treatments for orthopedic conditions. There's a lot of variability in how you can do these kind of treatments. One of the real focus that we have within the Regenexx network is trying to do these in as much of an individualized care manner as possible. So we can vary the strength of, let's say, your platelet concentration that we want to use depending on the sort of injury that you have. That is difficult, if not impossible to do if you're using a one-size-fits-all sort of machine-made system. We're doing everything in a very customized setting because we're able to do it within a lab setting. This makes a difference because certain types of injuries do better with certain types of platelet preparations, while others will actually do worse with those kinds of preparations. You have to vary it depending on what you're dealing with and the individual that you're dealing with. In addition, imaging guidance is essential for these kind of treatments. These are different than steroid injections. You should never be giving these kind of injections without guidance, not just from a safety purpose, but because when you're injecting cells, such as platelets or your own stem cells, you need to make sure that you're really delivering them in that exact correct area, down to a sub-millimeter level. So imaging guidance is essential here. And as I mentioned, you know, the kind of treatments that we're using are changing literally year to year. For example, the type of stem cell procedure that we're using now it's a second-generation procedure. It's not the same one that we were using 6 months ago. The type of platelet-rich plasma or platelet lysate procedure that we're doing has evolved over time. Even the joint supplement that we recommend is one that's actually been tested in the lab in terms of how well it can work with stem cells. There's a continuous emphasis on research when it comes to these kind of treatments within the network. So why does that matter? For example, we're using a newer type of stem cell prep. And not only do we get a higher count and strength of stem cells as we do this, but the actual clinical benefits for patients are evident. For example, with a newer prep of stem cells, we now have a better improvement in function in our patients. Individual pain relief is improved, and just overall benefit of treatments are better than what we were doing before with improved preparation method. So I mentioned clinical registry publishing results, being completely transparent about how people are doing is essential. These treatments have been around from the Regenexx clinic since 2005, and our current protocol has been revised and slowly modified for the last 9 years. Like I said, transparency is essential for this. Who's a good candidate? Who's not a good candidate? What's the research say about what actually works? Costs, of course. And, of course, any other questions for these kinds of new procedures, and, you know, what are the sort of people who succeed and who are the kind of folks who are not going to do well with these kind of treatments. That's all essential to know before you take any kind of treatment. My general approach to these kind of treatments are, if you've got a mild to moderate injury, platelet-rich plasma is a good treatment to consider. While if you've got a more moderate to more advanced injury, the Regenexx same-day stem cell treatment protocol is probably a better approach. In terms of platelet treatments, you know, the way that platelets are involved in terms of helping in these kind of situations are, after you have an injury, your platelets normally get dumped into that injury site. Platelets help to recruit other cells, other growth factors to assist in repair. So platelet-rich plasma is a biologic treatment. It uses your own body's own normal repair process. Essentially what we're doing is creating a very focused degree of inflammation to help repair your tissue damage. The two types of platelet-rich plasma there's your standard platelet-rich plasma, where we're essentially concentrating this to anywhere from 5 to 20 times your normal level of platelets. And then there's also a type of platelet prep that we call platelet lysate, where we essentially take your platelets, crack them open, and just take the growth factors. We combine these two frequently in order to get a better response in our patients. What's involved in a platelet-rich plasma treatment is you get a blood draw. We then prepare that accordingly depending on what we're trying to create for your particular injury. We're using imaging guidance to place cells in the injury area directly, and we're gauging outcomes at 2 months. I generally tell people that you should expect to do 2 to 3 treatments to obtain the best results with this kind of treatment. As a standalone treatment, I think it's great for mild to moderate arthritis, tendonitis, or if you've got a ligament injury. We routinely combine this with stem cell treatments, and there's good data showing its benefit in osteoarthritis compared to visco supplementation gel injections. There's also good data showing its efficacy for tendonitis, and it's also known to help tighten ligaments if you've got a chronic ligament injury. So PRP for tennis elbow. Again, the patient I described has tennis elbow. There's really excellent evidence on PRP treatment for tennis elbow. There's a number of studies that have been published showing its efficacy. Alan Mishra, who's an orthopedic surgeon out in Stanford, has sort of one of the original articles on PRP efficacy in orthopedic injuries, published in 2006. And in his study, which is really quite remarkable, comparing PRP to just placebo, he found that there was a dramatic difference in terms of efficacy. And at the 6-month mark, the folks who got PRP were 80% better, and the folks who got at the 1-year mark were 93% improved. That's pretty dramatic. In my practice, this is really the first-line injectable treatment for tendon-related injuries. I think it's a lot safer and a lot healthier long-term for any kind of tendonitis. Okay, so case number 2. This is a 54-year-old man who came to me with left shoulder pain. He originally injured his left shoulder playing high school football, and just over time has progressively gotten worse to the point where he's having difficulty even exercising. He has an ultrasound and MRI, which I'll show, that show partial thickness tears of the supraspinatus tendon. He completed physical therapy, was still having functional difficulty, and was referred to me, and he ended up undergoing the Regenexx same-day stem cell protocol, and we'll talk about how he did. So this is an example of his shoulder ultrasound. This is the supraspinatus tendon, one of the main tendons in the rotator cuff. This area right here, again, this black hole right in the tendon, that is an example. That is a partial thickness tear in a supraspinatus tendon. This is the same tendon. Again, here's the tendon. This is a tendon tear, and this is actually the needle coming into place. And eventually, the cells are deposited right directly into his tendon tear, and that's actually what helped him heal that injury. It's an example. A couple other kind of nice MRI and X-ray pictures, just to give a sense for what are some of the potential benefits from stem cell treatments for shoulder injuries. This right here is an MRI showing a tear within the rotator cuff. That's that white area right there. It's an individual that received 2 treatments of her own stem cells, and 6 months later, or 7 months later, had a pretty dramatic improvement in her tendon tear. It's another example of a patient that had a full thickness tear of his rotator cuff, and again underwent the Regenexx same-day stem cell treatment and had a nice repair of that tendon as well. This is just another example of whether we're using ultrasound or whether we're using C-arm, X-ray fluoroscopy, and in this case, this is a needle coming in, injecting dye into the joint just to confirm we're in the right spot, using either ultrasound or advanced X-ray imaging to really confirm that we're injecting in the right place. That's the right way to do these kind of treatments. So what are stem cells? So essentially, stem cells are the repairman of your body. They are cells that have the ability to become other cells. They have the ability to renew themselves. You actually have stem cells in pretty much every tissue type in your body. The purpose is that when you do have any kind of injury or any sort of regenerative process that's required, they're available to come in and create that process. In fact, even in the normal course of a day, for example, if you went for a jog, your body's normal process of helping to repair itself after that is that your stem cells are involved in that sort of repair process. There's actually several different types of stem cells. The ones that have been best studied and best analyzed for orthopedic injuries are mesenchymal stem cells, and that's the one that we use for these treatments as well. So the Regenexx stem cell protocol, there's a few things to keep in mind. Number one, we're talking about adult stem cells. These are not embryonic stem cells. There is no ethical issue here. These are your own stem cells, meaning autologous, they come from your own body. So the chance for rejection or allergic reactions, that just doesn't happen because it's coming from yourself. We do stem cell treatments that come from your bone marrow. When you look at the literature for stem cell treatments, the overwhelming amount of research comes from stem cells that come from the bone marrow. That's really the right type to use for orthopedic injuries. The stem cell protocol that we use is actually a 3-treatment protocol. Again, this is one that's been devised and revised over 9 years. And essentially, there's a pre-injection of what we call prolotherapy to help prep the area that we're going to treat. About 3 to 7 days later, you get a blood draw and bone marrow aspiration, and then re-injection of your own stem cells into the area that requires treatment. And then again, 3 to 7 days later, we do another platelet injection, another blood draw, platelet-rich plasma injection, basically to help feed the stem cells. So one thing that everyone always asks is, isn't a bone marrow aspiration painful and awful? And the reality is, if you do enough of these, you learn how to do them in a way that is safe as well as comfortable for the patient. Essentially, it takes a lot of numbing medication, and when we've actually surveyed patients about how uncomfortable was it, really the overwhelming majority of folks say that it was not nearly as bad as they expected, and they would certainly do it again in order to get treated. So who are the kind of patients that we're treating with these sort of stem cell treatments? Certainly weekend warriors, active elderly, there are some professional athletes, young athletes, and even folks that just have had an injured joint or tendon from a prior trauma or injury and still require some benefit. So safety, when it comes to any sort of treatment in medicine, of course, safety has to be our first and foremost concern. And when it comes to safety for stem cells, there are really 3 different groups that have looked at this. The Regenexx group, our own group, there's a group out in Spain, and there's a group in South Korea. And overwhelmingly, the data supports that these treatments are as safe as any other kind of injection procedure. It's very important to recognize that these are autologous procedures coming from yourself. So the kind of things that could potentially happen if you were taking cells from someone else, these do not occur when they come from yourself. These treatments are compliant with FDA regulations. The kind of things I tell people to expect are, number one, it's an injection, so you'll have some discomfort. We numb things down as much as possible, but like any injection, there's a little bit of a needle pinch. In addition, there is some inflammation for a few to several days after treatment, and that's part of the process. These treatments do require a little bit of patience. You're not going to see a turnaround within days to a week. You have to give this a few weeks to a couple months to really get the best outcome. So back to my patient who had the left shoulder rotator cuff tear. He was treated with the Regenexx same-day stem cell treatment protocol. At the 4-month mark, he's had significant reduction of pain, and he's restarting his exercise activity that he really had not been able to do. So he's having a pretty good response thus far. So, what are the things to take away from this sort of case? Number one, a significant arthritic and tendon injury can still benefit from the Regenexx stem cell protocol. In particular, there is this expectation that folks that have a significant injury that they can only benefit from surgery. That's not accurate. If you're looking for the strongest and most effective non-surgical treatment, that would be the stem cell protocol. Realistically, if you have an advanced injury, it may not be possible to repair fully the damage that you have, but you can still get significant pain relief from these sort of treatments, even if you're not completely repairing the injured tissue. And of course, once again, I'm emphasizing imaging guidance to specifically deliver these cells is absolutely essential if you want to get the best response. So, of course, do these treatments work? We're talking about the shoulder right now. So, here's some of the data from within the Regenexx network in terms of showing how well this kind of treatment can help. When it comes to shoulder and rotator cuff, when we look at outcomes, what's curious is, and this includes a group of patients that have shoulder arthritis as well as rotator cuff tears. And what you'll notice is that there's a slow and progressive improvement over time. I generally recommend to people that we are judging outcomes at the 3, 6, and 12-month mark and even further out than that. In this case, when it comes to shoulder and rotator cuff from this study, what you find is that at the 6-month to 12-month mark on average, there's about 55% improvement in terms of pain and function. And that actually continues to improve when you start getting out to the 18 and 24-month mark, where you're starting to get close to about a 70% improvement. What's curious is that when you look at a subset of these patients, when you're talking about strictly rotator cuff or labral tears, excluding the arthritic component, you find that these patients do even dramatically better. For these folks, the average improvement at the 1-year mark was about 70%. And in regards to folks who were getting more than a 70% improvement, that was actually about 70% of folks who were analyzed in this study. So that's a pretty dramatic improvement. When you look at studies for how well people respond in terms of pain and function in orthopedic injuries, whether you're talking about physical therapy, pain medications, steroid injections, gel injections for arthritis, or even surgery when it comes to replacement or rotator cuff repairs, these numbers are, the numbers that you're seeing here are certainly better than any other non-surgical treatment, and they are comparable and in many ways sometimes better than the actual surgical responses as well. So this is impressive stuff. For the second procedure help, I mentioned that for platelet-rich plasma, it does typically take a couple of treatments to really get the max benefit. When it comes to stem cell treatments, I definitely recommend that people give at least 6 months to see how well you're going to do. And if you're plateauing in terms of your response, then consider getting a second treatment at that point. From within the Regenexx network, what we're seeing is that after a first treatment, people typically get another 20 to 25% of improvement after a second stem cell procedure. And just a reminder again, for more sort of up-to-date results and outcome data for these kind of treatments, you can see all that at my website at chicagoarthritis.com/results. So just to conclude, some take-home points here. There are definitely better and healthier ways to treat arthritis and tendinitis. I think the ideal way to treat someone who has an orthopedic injury is by combining a change in biomechanics with some of the best and most up-to-date regenerative treatments available. The science behind stem cells is changing very rapidly and improving. What we're doing right now, as I mentioned, is dramatically better than what we were doing 6 months ago. And what we'll be doing in a year or 2 years or 5 years from now will be dramatically even better. Not only is the science behind how to use stem cells improving significantly, even some of the tools that we're using for treatments, whether it's the type of imaging modalities that we're using, like ultrasound, or even some of the needles that we're using. These are all things that are rapidly changing, and this is a field that probably in the next few years, in the same way that cardiac surgery has really been minimized because of interventional cardiology and percutaneous procedures, needle procedures, we're going to be seeing the same thing with orthopedic surgery. The things that I recommend when it comes to pursuing regenerative treatments, things that you want to keep in mind. Number one, make sure you're using protocols that are not brand new, but they've been used in thousands of patients. These treatments should have published results if you're going with a protocol. Imaging guidance must be used for all of these treatments. If you're having these treatments done blindly, you're really not going to get the best effect. And again, keep in mind the field is changing. Make sure you're getting the newest and best treatments in the most safest way possible. Well, that concludes my sort of talking portion. Let's see if there's some questions. So, all right, so somebody asked about osteoarthritis in knees. I actually presented on that last month. If you, I will actually send you a link to that webinar, but yeah, absolutely. These certainly can be used in osteoarthritis for the knees. They are a really great option for that. Next question was, are these treatments effective for AC joint osteoarthritis? And again, the answer is yes. I think the one key thing is when it comes to AC joint osteoarthritis, is that the only issue there, or does somebody also have rotator cuff pathology? Do they also have any concomitant ligament laxity as well that needs to be treated as well? But absolutely, these treatments are definitely effective for that kind of arthritis as well. Is this treatment covered by insurance? Unfortunately, it is not. These treatments they're still considered new, which quite frankly doesn't really make a lot of sense because they've been around since at least 2005, and there's actually data from Europe for stem cells going back to the late 90s. And so it's unfortunate, but right now insurance does not cover these. The next question asked about rheumatoid arthritis. You know, I treat rheumatoid arthritis as well, but I don't treat rheumatoid arthritis with these kind of treatments. I certainly do have patients with rheumatoid arthritis who also have wear and tear arthritis or tendonitis issues as well, and treating in that setting with platelet-rich plasma or stem cells is certainly appropriate as well. But I think in terms of these treatments work for that active inflammation of rheumatoid arthritis, that's hard for me to really say right now. I do not recommend treating that at this point. That may change over time, but currently I'm not recommending that. Okay, so someone had a question about approximate cost. Again, you know, it's shoot me an email. If you send me an email at clinic, CLINIC, at chicagoarthritis.com. You can send that to me either directly or you can go to my website. We can give you a sense for how much things cost. Okay, and yes, absolutely. There's another question about the webinar for the osteoarthritis and knees, and I will certainly send that as well to you guys as well. If I recorded this appropriately, you guys will get a copy of this webinar as well if you wanted to rewatch it, and I'll also send you a link for the knee and the hip webinar that I did as well. Any other questions? Okay, great. Well, if there's no other questions, thank you very much for your time. If you do have more questions, you can always call or email at any time. And hope you all have a good night, and thank you for your time. Have a good day. Bye.